Have you ever looked at a prescription and felt like you're trying to crack some kind of secret code? Well, that's exactly what we're going to do today. In this explainer, we're turning that confusion into clarity, making you feel way more in control of your own health.
Yeah, we've all been there, right? Your doctor hands you a slip of paper with what looks like ancient hieroglyphics instead of medical advice. It can be super intimidating. Well, guess what? That feeling is about to disappear.
All right, here's our game plan. First, we'll touch on why this shorthand even exists. Then, we're going to decode all those terms for timing, frequency, and how to take your meds. We'll also cover some other common measurements. And finally, we'll pull it all together so you can really take charge of your health.
So what's with the secret code anyway? Well, it's not really a secret. Historically, these abbreviations, a lot of them from Latin, were all about speed and precision. It was a way for healthcare pros to communicate complex stuff fast. But now, we're going to let you in on the secret so you're on the same page.
Okay, first up, let's tackle the stuff you'll see most often: when and how frequently to take your medicine. You know, getting this part right is absolutely crucial. It's what makes a medication work the way it's supposed to, and safely.
All right, let's look at the daily frequencies. There's a really simple pattern here once you see it. QD means every day. Then you have BID for twice a day, TID for 3 times a day, and QID for 4 times a day. See that? It's all based on Latin, but once you get the rhythm, it totally clicks.
Now, here's a similar one, but with a huge difference. QOD. This means every other day. And it is so important not to mix this up with QD, which is every day. That one little letter O completely changes your treatment schedule.
These two kind of bookend your day. AM is easy, right? It just means morning. But HS, that one might be new. It stands for at bedtime. You'll often see this for meds that might make you a little drowsy or that work best while you're sleeping.
PRN. You're going to see this one a lot, especially for things like pain meds or allergy pills. It simply means as needed. This one puts you in the driver's seat, basically. You take it when your symptoms act up, not on some fixed schedule.
Okay, this one is serious business. If you ever hear the word stat, especially in a hospital, it means right now. Immediately, no delay, it signals the absolute highest level of urgency.
All right, so we've got the when down. Now let's move on to the how and where. Because believe it or not, the way you take a medication can be just as important as the timing.
Here we've got two complete opposites, and they're both super important. PO is probably the most common one you'll ever see. It just means by mouth. But its counterpart, NPO, means nothing by mouth. You absolutely have to pay attention to NPO. It usually comes before a surgery or some other procedure, and following that instruction is non-negotiable.
Now, this is a more specific by-mouth direction. SL stands for sublingual, which is just a fancy way of saying under the tongue. You place the pill there and let it dissolve. Why? Well, it gets the medicine into your bloodstream way faster.
Okay, time for eye drops. And this is a perfect example of how one little letter changes everything. OS means the left eye. OU means both eyes. A good way to remember this is that the S in OS stands for sinister, which is Latin for left. Kind of cool, right? And just like OU is for both eyes, AU is the same thing, but for your ears. So if your eardrops say AU, that means a dose in both ears.
Okay, we're on to our last batch of abbreviations. This group covers things like dosage, the form the medicine comes in, and a few other key terms you'll see on your chart. Let's dive into the details. Let's kick things off with a super easy one, TAB. It's just short for tablet. Simple as that. It's just telling you what form the medication is in.
Here are the two heavy hitters for measurement. mg stands for milligram, and that's for the weight of solid meds, like a tablet. Then you have milliliter, which you'll see as ml or sometimes cc. That's for the volume of liquids. And yeah, you'll often see ml and cc used for the exact same thing.
You'll see this one on pretty much any medical chart. BP is just the standard shorthand for blood pressure. It's one of those key vital signs doctors always track to see how you're doing overall.
This one's a quick way to note two really common symptoms or side effects. N and V is just nausea and vomiting. You might see it in your doctor's notes or listed as a possible side effect for a new medication.
And this is a really big one to watch out for. DC means discontinue. If you see this next to one of your meds, it means your doctor wants you to stop taking it. It is a critical instruction, so you definitely want to pay close attention to that.
So, we've cracked the code. We've decoded the language. But now for the most important part. What do you actually do with all this? This is where you go from being a patient to being a partner in your own healthcare.
Okay, here's what you can do, starting today. Next time you get a prescription, really look at it. See how many of these terms you recognize now. If there's anything at all you're not sure about, just circle it. And the most important step, always ask your doctor or pharmacist to explain. Seriously, there's no such thing as a dumb question when it's about your health.
Because in the end, this is what it all comes down to. Understanding your treatment is just as important as the treatment itself. Knowledge really is the best medicine. It's what keeps you safe and helps you get the best possible care.
And that kind of leaves us with one last thing to think about. We've gone over what all these letters mean, but maybe the most powerful tool you have isn't knowing an answer, but asking a question. So think about it. What's the most important question you can ask about your own health?